Hi everyone. So we know that the past 12 weeks have been a real challenge for everyone, both at home and at work. I really appreciate how hard everyone's worked to manage this situation, transforming the way we do things in the workplace, whilst at the same time trying to support our loved ones with all the challenges that they face too. In recent days, we've become increasingly aware of the fact that COVID-19 has had a disproportionate impact on members of our Black, Asian and minority ethnic community. This has really challenged our thinking in a number of ways, and I believe that some things have been brought into even greater focus with the very disturbing pictures and the news coming from America following the tragic death of George Floyd. For me, this is a time when more than ever we must remember the value and contribution of every individual and face up to the fact that not everyone always feels equal. Within our hospitals, we've been working hard to ensure that all our staff, but in particular our BAME colleagues, feel valued and supported in carrying out their work. A few of our BAME colleagues have been receiving treatment for COVID, and I'm so pleased that all of them are making a really positive recovery. Some of you may have seen the update on Twitter about Michael, who's now back at work on the stroke unit following his time in the intensive care unit at Royal Bournemouth Hospital. We could not be more delighted to have him back in our midst after such an ordeal. Really good to see you there, Michael. So yesterday I sent out a personal letter to all BAME colleagues. That's nearly 2,000 members of staff across both our trusts. And today I'd like to reiterate the key messages contained in this document. The letter's gone to your home address to give you an essential update on the things that we're doing to keep you safe at work, and to signpost you to further emotional support if required. Very importantly, I've instructed all our line managers to ensure that every single one of you receives a health and safety risk assessment to keep you safe at work. This will ensure that you have the opportunity to share any relevant information about your health and your well-being, and for action to be taken around that. Please be assured that this discussion with your manager is private and confidential, and you'll be encouraged to access further support from our occupational health team, along with other support services if appropriate. You can expect to hear from your manager very shortly. This is an extra measure because I know that many of you have already had those conversations with your line managers and have been in touch with our occupational health department for advice. I'm also aware that many of you have had conversations with members of our BAME staff networks who've been doing a really good job in providing support to colleagues. In Bournemouth, Minnie, our BAME network lead, and her colleagues, they checked in on our new overseas nurses who were self-isolating, making sure that they had practical as well as emotional support. Thanks, Minnie, for doing this, and thanks also for sharing your own very personal story so movingly on ITV News recently. In Poole, Joy and Judith have been doing a brilliant job following up on a range of queries raised by BAME staff. Thanks so much to both of you as well. We've now secured a dedicated mobile phone to make this easier. There's a lot of confidential emotional wellbeing support available both internally and externally, including a dedicated Filipino helpline. Details of these are in my letter and also on the information cards that are available in the wellbeing information hubs in both Poole and Bournemouth hospitals. I want you to feel confident that everything possible is being done to support you during a really unsettling time. If there's anything else that you feel would be helpful, please raise this with your line manager or with one of the leads. In other news, I was delighted to have the opportunity to visit Christchurch Hospital this week. It was a real privilege to be able to connect again with so many staff. There are many very important services provided from Christchurch Hospital, and the teams there have been doing some absolutely brilliant work during COVID. Some members of the team have been redeployed to the Royal Bournemouth Hospital site, either as part of the temporary move of the Macmillan unit or simply to support the surge in demand that we've known was coming for acute medical services. This is always unsettling to staff, so we're very grateful to them for that. Those within our rheumatology and dermatology services at Christchurch have been doing a brilliant job continuing to treat patients by remote working, for example through video or phone consultations. Meanwhile, the team in the day hospital has completely transformed their service to focus much more on the community and on outreach, commencing 7-day assessment and targeted rehabilitation of patients. It was a great pleasure to connect with colleagues on the Christchurch site again. I just want to say a big thank you to all of you for your flexibility and your amazing commitment. You are all quite brilliant. Finally, just wanted to flag that this week is Volunteers Week. Well, normally we'd have planned a range of ways of celebrating this together in person, wanting very much to recognise the enormous contribution that all our volunteers make. Unfortunately, given the situation with COVID, we're not able to do this in the usual way, but I would like to say on behalf of both trusts how very grateful we are to all of you for all that you do for our staff and patients. Whether you volunteer directly or whether you do so through our many supporting organisations, you're all equally valued. Thank you so much for helping to make the Royal Bournemouth Hospital, Christchurch Hospital and Poole Hospital the places that they are today. Thank you for giving up your time. So I just close with my usual thanks to everybody for doing such a great job. As you know, I'm extremely proud of our staff and our services across all 3 sites. Do take care and stay safe.